ever felt really sore following a workout? Not straight away, a day or two later. Oh, the pain can sometimes be unbearable. I mean, I've struggled to get up and down the stairs, get out of a chair, or even struggled to walk following a hard, intense workout, or if I've not done anything for a little while. This phenomenon is known as delayed onset muscle soreness and is very common, particularly if you perform exercises or activities that you haven't performed before or you haven't performed for a long time at least. Delayed onset muscle soreness, or DOMS for short, is actually classified as a type 1 muscle strain injury. Now, muscle strains are classified in 3 different ways. A type 1 muscle strain, or first degree muscle strain, is a partial tear of individual muscle fibres and is characterised by strong but painful muscle activity. A type 2 or second degree muscle strain is a partial tear with weak, painful muscle activity. And a type 3 or third degree muscle strain is a complete tear of the muscle fibres and is manifested by very weak and even painless muscle activity. The sensations experienced with DOMS can vary from slight muscle stiffness to severe unbearable pain, which actually limits your movement. Tenderness is usually more concentrated within the belly of the muscle because this is where there's a high concentration of pain receptors and becomes progressively worse about 24 to 48 hours after exercise. DOMS is usually associated with unfamiliar high force muscle action. So if you perform a workout or activity that you've never done before or trained at an intensity higher than usual, then this can cause more stress on your muscles and increases your chances of experiencing DOMS. So what is DOMS? Well, there are 6 competing theories for what causes DOMS. The lactic acid theory is based on the assumption that lactic acid continues to be produced after you complete a workout. It's thought that the accumulation of lactic acid causes a harmful response and the feeling of pain at a delayed stage. However, this theory has largely been rejected as lactic acid levels actually return to normal within 1 hour following exercise. So lactic acid may contribute to muscular pain immediately after intense exercise, but not the delayed pain that is experienced 24 to 48 hours after exercise with DOMS. The muscle spasm theory came about following the observation of increased levels of resting muscle activity after exercise. It was suggested that this increase in resting muscle activation caused a localized spasm of motor units within the muscle, which was thought to lead to a compression of local blood vessels, an inadequate flow of blood to the muscle, and the accumulation of painful substances, which in turn creates a vicious cycle, as more stimulation of nerve endings causes more muscle spasms and prolonged reduction of blood flow to the muscle, which causes more pain. The muscle damage theory, or microtrauma theory, focuses on the disruption of the contractile component of the muscle tissue, where microscopic lesions cause widespread disruption at a cellular level, which stimulates pain receptors within the muscle. That leads to the sensation of pain. The connective tissue damage theory examines the role of connective tissue that forms sheaths around bundles of muscle fibres. Now, the content and makeup of connective tissue differs between different muscle fibre types. Type 1 or slow twitch muscle fibres, which are more accustomed to aerobic exercise, have a much more robust structure to that of type 2 or fast twitch fibres that are used predominantly in anaerobic activity. Subsequently, fast twitch fibres can sometimes have an increased susceptibility to stretch-induced injury, and excessive strain of the connective tissue may lead to muscle soreness. The inflammation theory is based on an inflammatory response that occurs in a muscle following exercise due to an increase of fluid within the muscle tissue, which leads to an increase in pressure and subsequently cause pain 24 to 48 hours after exercise. The enzyme efflux theory is based on the assumption that calcium builds up in injured muscles following strenuous exercise, which causes ATP regeneration, which is required to transport the calcium, to slow down. This slowdown in ATP regeneration causes muscle protein to weaken and causes pain. Now the thing is, not one of these 6 theories can actually explain the onset of DOMS. In fact, it's a unique series of events combining the different models that help explain the DOMS phenomenon. High forces produced during strenuous exercise cause disruption of structural proteins within muscle fibres. This is accompanied by excessive strain of the connective tissue around the muscle fibres. This muscle damage causes a buildup of calcium within the muscle, which inhibits the production of ATP, which is vital for protein repair. Within a few hours, an inflammatory response increases fluid within the muscle tissue, and this buildup of fluid peaks around 48 hours after exercise and causes pain. These events lead to the sensation of DOMS. Now, if you experience a bout of DOMS, it's really important that you allow yourself adequate time to recover before you get back into your next workout or training session, because it can affect you in a number of different ways. Because DOMS can affect your full range of motion, you are unable to absorb forces as efficiently as you normally would. Things like landings in running or landing after a jump, because of the reduced capacity to absorb shock in the usual places, shock absorption will occur at other joints that aren't used to having to accommodate this. That can cause added strain on other muscles, joints, ligaments and tendons. DOMS can cause changes in coordination, which also leads to strain on other muscles, ligaments and tendons. A reduction of force output by an injured part of a muscle may lead to other muscles having to compensate, which can cause unfamiliar stress and increase the risk of injury. Also, a reduction of strength or power during a bout of DOMS may lead to you working at a higher intensity than you're used to, which increases your risk of injury. A good example of this would be during a weights program and you experience DOMS from your previous session, but you need to increase the weight in your next session, or at least work at the same intensity to achieve the gains you're looking for. You need to be aware that you'll probably need to work even harder due to the reduction in strength or power from DOMS, so you will be increasing your risk of much more serious injury. So, I suppose the magic question is, what can you do to alleviate the symptoms of DOMS and help you recover as quickly as possible to be ready for your next workout or training session? Now, there are a few things that are recommended, so let's have a look at them. So the usual recommendation for most joint or muscle injuries is rest, ice, compression and elevation. The application of ice actually has an analgesic effect, so reduces pain. Applying for at least 20 minutes reduces the temperature in the affected area, which reduces inflammation and any swelling. Now, whilst this is great for acute injuries, a grade 2 or grade 3 muscle strain, it actually provides little benefit in the prevention or treatment of DOMS, because the inflammatory response is much smaller than with a muscle tear. So whilst ice is the recommended treatment for most joint or muscle injuries, its effectiveness to help avoid or treat DOMS is actually fairly minimal. Static stretching, both before and after exercise, is recommended to help prevent DOMS, as it's thought to prevent muscle spasm and reduce any fluid buildup or swelling following exercise. Now, in theory, stretching helps reduce tension in a muscle and improve flexibility, which in turn helps prevent any stretch-induced injuries. However, it's important to understand that static stretching for long periods, 60 seconds or more, can actually cause similar symptoms to DOMS. While stretching plays an important role in improving flexibility and reducing tension, its benefit to preventing or in the treatment of DOMS is also fairly minimal. The buildup of calcium in your muscles following strenuous exercise can be reduced by increasing the amount of oxygenated blood flow to the injured area. This is where massage may be able to help, as increased blood flow from massage can help reduce the inflammatory response and deliver more oxygen to a muscle to help lower calcium levels back to normal. Whilst the theory makes sense, and who doesn't like a nice relaxing massage, studies into the effectiveness of massage at reducing the signs and symptoms of DOMS do vary, as there are so many different massage techniques and so many different types of massage therapists. So if you want to have a massage to help your DOMS, make sure you pick the right type of massage. Compression garments are increasingly popular among athletes who wish to improve and reduce exercise-induced discomfort and injury risk. Now, this is backed up by good evidence that compression stockings help treat or prevent deep vein thrombosis, which is one of the reasons why you're asked to wear them if you ever have to stay in hospital. The thing to consider here, though, is the pressure rating of the compression garment, as anything lower than the clinical grade stockings that are used in hospitals will not provide the adequate pressure needed. In relation to DOMS, there's currently no evidence that conventional sports compression garments have any effect on the prevention or treatment of DOMS. The most effective strategy for alleviating DOMS is actually exercise itself. Exercising helps break up any adhesions in sore muscles and increases the removal of any harmful waste products thanks to an increased blood flow and an increase in endorphins being released. This endorphin release results in an analgesic effect that actually minimises the sensation of DOMS. Be aware though that this pain relief is also temporary and the DOMS sensation will return when you finish exercising. Active recovery and keeping on the move is my best advice if you ever suffer from a bout of DOMS. I hope you've enjoyed this video. Don't forget to like and share with your friends, and see you next time.